Hi, everyone. Welcome to History on Trial, Science on Trial. This is Dr. Tracy McCarthy, psychologist, attorney, and educator, hoping that you all are doing well. It's been a while. There's a lot going on, and I guess this is, as Prince would say, a sign of the times. So we are going to be continuing our discussion related to Mythbusters. In other words, lie busting. And so we're going to be looking at some myth busting related to science. And so science is on trial right now. And we are entitling this God is in the details. Now, usually you hear the devil is in the details. We're going to switch that around to the original wording, which is God is in the details. And we're going to look at some of these details. And we are continuing our discussion related to the extent to which antibiotics may or may not be helpful or useful with respect to viruses. We're going to be very specific. However, we're going to be looking at the likelihood that antibiotics may be effective in relation to the current situation. So we're going to be looking at this myth busting dynamic related to the World Health Organization. And their assertion, the fact that they've asserted, is that antibiotics cannot prevent or treat viruses. And so it's important to remember that facts, while they may be compelling, they are not necessarily the truth. And so the assertion here is an assertion that people have heard over the years, that antibiotics work only against bacteria and not against viruses. And we're going to look at some research that suggests otherwise. Now, what's concerning about this research is that this research seems to be coming from particular parts of the world, and there seems to be a dearth of research related to the same topic coming from other parts of the world where you would be expecting this research to be coming from. And so we are going to look at the extent to which there are certain antibiotics. We're going to look at one antibiotic family in particular, and you're going to see that there is a heavy indication that this particular antibiotic family does have some probability of being effective with respect to the current situation. So let's address Mythbuster number one. And we're going to jump into this research, and we can see here an article from Infectious Diseases indicates that minocycline may be an adjunctive therapy option for the treatment of the current situation. And here the researchers indicate that there are a number of antibacterial medications that have implications for actually treating viruses, or viruses respond to these particular substances. And you can see down below it indicates literature review found that minocycline had both in vitro and in vivo broad spectrum antiviral and anti-inflammatory activity. It's important to note that in vitro is in the lab and then in vivo is in real life. And so there is an indication that this particular antibiotic has indications for treating viruses, and that there should be more work done to determine the extent to which this particular antibiotic may be effective for this current situation that we are dealing with. Moving right along, we have an additional article indicating that minocycline should be considered for repurposing for the current situation. Repurposing is basically where you take a medication that is already approved and used for something else and then just use it for another situation when there is an indication that there might be some efficacy. And here we have a discussion, expert opinion, indicating that this particular medication, this antibiotic, it has a really good safety and interaction profile, relatively low cost, and widespread availability. There is some indication, however, that it may be a little bit more difficult for some countries and groups of people to actually get access to it. But it is more widely available than some of the newer things that might be coming up. So this is a very old medication. And here there's a discussion related to minocycline and its potential with respect to the current situation and the complications from the current situation, because that is often the issue that we are dealing with, is that individuals are dealing with complications from the situation, just like you would be dealing with complications from influenza. And so one of the things to note about minocycline is that it is effective for a number of microbes. And one is Mycoplasma pneumoniae and chlamydia. And so this is important because this current situation actually mimics more than just influenza. It actually mimics Mycoplasma pneumoniae, and we can talk about that later. And Mycoplasma pneumoniae is responsible for what is known as walking pneumonia. And so where you see individuals who may have low symptoms or low recognition of symptoms and low signs, those would be external indicators that there is something wrong, but the person is walking around with pneumonia. And so that is what this current situation also looks like. And so here you have minocycline that works on Mycoplasma pneumoniae. Now, Mycoplasma pneumoniae is a very interesting microbe because it has similarities to bacteria, virus, and fungus. And so we can kind of look at it like the cat dog of the microbe world. And here you see some other dynamics related to minocycline that also call attention to this particular medication in terms of its potential for dealing with the current situation. And so you can see it's anti-inflammatory and it's antioxidant. And this is very important because these are two dynamics that seem to be rearing their heads with respect to the current situation. And that, in a nutshell, is what is causing most of the problem. And so you have this medication that is not only anti-inflammatory, it's also immunomodulatory, meaning it modulates the immune system. And that's a very important dynamic with respect to this current situation. And so you also see down below that it reduces the secretion of cytokines, specifically interleukin 6 and 2. And so this is very important, again, with respect to the current situation. And here the article goes on to talk about the importance of considering minocycline in this current situation and repositioning it because it has a proven safety record of clinical use over 35 years. And it's pretty much devoid of any major significant adverse effects or drug interactions. And so this is a very important pharmaceutical to consider when you are talking about the current situation that has not been considered. And part of the reason it hasn't been considered as much as it should be is because of that rhetoric that has been going on for forever related to the relationship between antibiotics and viruses. Another point indicated here is that minocycline can be readily deployed worldwide at affordable costs for families and for countries that can actually pay for this. And here you have a call for drug regulators to expedite and accelerate development of some potentially life-saving therapies. However, you already have some things that are already on the table, some very old medications, not just this one, that should be considered in this discussion. Anything that has taken over the world in the way that this situation has taken over the world, putting things at a standstill, should call for accelerated research on things that are already on the table to see if those things may be effective in dealing with this particular type of situation. So there has been a lag with that. There has been some effort toward that, but an insignificant amount of effort has taken place given all of the things that are on the table, all of the potential medications that are out there that may have a positive impact on this. And moving right along, we see back in 2011 coming out of India. So you have the Indian Journal of Medical Research, the use of minocycline in viral infections. So again, this is not new information. And this is something that should have probably been addressed right up front, particularly given the fact that this particular situation so closely mimics Mycoplasma pneumoniae infection that there should have been an attempt very early on, first of all, to do adequate isolation and to fulfill Koch's postulates. There should have also been significant effort made to make sure that there was no mycoplasma contamination in the samples, and also individuals should have been tested for other microbes while being tested for the main microbe, because you want to make sure you don't have a co-infection going on, and you also want to make sure that there isn't something else, some cofactor at play that's causing all of this havoc. And that is a high likelihood that you've got a cofactor going on, meaning you got another microbe in action, in play, and that microbe is being ignored. And so when that microbe is being ignored and other things are sort of taking center stage, the ignoring of that microbe may then lead to a person getting ineffective treatment because you're not dealing with the totality of the circumstances. And so here we have some additional researchers indicating that this second generation antibiotic, minocycline, has antiviral proclivities. And because of this, this medication is so potent and it has been so effective in dealing with another virus. And that virus has been the human immunodeficiency virus, HIV. And so minocycline has been helpful in preventing HIV infections. And this has been known for a while. And so accordingly, it probably should have been one of the first medications tried in terms of dealing with this particular microbe situation that we're dealing with right now. And so again, they indicate that it has anti-inflammatory properties and it's immunomodulatory. And so this is very important because again, this is the main dynamic that's being presented as the main problem with respect to the current situation. It's important to note that this isn't some hidden information. This information's out there, it's public. You can see that it's published on the website for NIH, which is the National Institutes of Health. And so clearly many people already are aware of this in the healthcare field. And so what you can see here is, again, back in 1990, they knew that this particular medication, this antibiotic, provided protection against HIV. Okay, and so that's important to note. So there was already an indication that this medication was effective with respect to viruses. And so it's unclear why all of these clinicians are continuing to spin all of this rhetoric about antibiotics not working on viruses. It's not so important how they work on viruses. The important thing is that they do work on viruses, and then you can get back to how they work on viruses. But it's important to make that paradigm shift that follows what the science is saying. And so you do have a body of science that says particular antibiotics do work on viruses. Now, the other alternative is the possibility that the thing that you think is a virus perhaps is not a virus, and that's why the antibiotics are working so effectively. And so those are some things that researchers need to look into. That's not something that we're going to delve into right now. And here you see the authors also indicate that it can be used as an antiviral drug, and so therefore it's ideal in terms of repurposing of an old drug for this new situation that we are dealing with. And we're going to come into 2020, And you could see in June of 2020 that in Medical Hypotheses, there was an article written related to doxycycline, which is sort of the cousin or sibling of minocycline. Doxycycline or minocycline may be a viable treatment option against the current situation. And here, these researchers indicate very clearly and very specifically, with respect to the current situation, there is efficacy indicated with both doxycycline and minocycline. And so this should have called attention to this particular drug for repurposing at the very beginning. And here we go again with an editorial piece. And you can see here doxycycline as a potential partner for these therapies for the current situation. And so here, looking at minocycline's cousin or sibling, doxycycline, we can see that doxycycline has both antiviral and anti-inflammatory actions. And most importantly, it has the capacity to do what's called dampening of the cytokine storm, which would then prevent the lung damage that has been prevalent. And so doxycycline is also important because doxycycline is the primary medication that is used for treating Mycoplasma pneumoniae again. And so you have this cytokine storm that goes along with that Mycoplasma pneumoniae and that potential lung damage that goes along with it with respect to the cytokine storm. And so again, this is something that should have jumped out at researchers immediately. Also clinicians, this should have jumped out at them immediately in terms of an option for treatment. Now you'll often hear these fancy words about therapeutics. And so basically we're talking about medication. And so these medications should have automatically jumped out, particularly when there was an indication that the hydroxychloroquine might be useful, because you have the hydroxychloroquine and the doxycycline both being used in relation to malaria and also lupus. And so again, these are some medications that should have been considered right up front. And then it gets very specific. And so not only is doxycycline antiviral, but it's effective, along with minocycline, it's effective with respect to RNA viruses. And that is specifically what we are talking about in the current situation. And so they also are responsible for helping to reverse those cytokine storms. And we have additional information here related to the anti-inflammatory effects of doxycycline. And so it actually reduces inflammatory cytokines. And this is important, particularly when the assertion is that certain groups of people seem to be more prone to develop these complications. And so what has happened is that you have a number of individuals who tend towards autoimmune disorders, and that tendency towards autoimmune disorders might also place a person at risk for significant inflammation in the body. And sometimes this seems to relate to certain ethnic groups. And here the researchers are very specific, and they indicate in the box, you can see this, that they are suggesting that there should be a large retrospective cohort study assessing disease severity, co-infections, mortality rate, and length of hospitalization with respect to individuals who actually used doxycycline or tetracycline based medications in terms of treatment for the current situation. And so that would give quite a bit of information, quite frankly. And then you might also want to start looking at individual physicians who have used this as a treatment in terms of case studies to see the efficacy that they were able to achieve with these particular medications. Now we are continuing with myth busting, and we're at myth buster number 2. And we're going to address this deifying of science and scientists that seems to be emerging. And what that means is placing science and scientists on this pedestal as if they are God. One thing that the current situation has revealed is that there is a growing trend towards this deifying science and scientists, as we've indicated. And there is this push for this rhetoric about in science we trust. And so individuals need to really start to think about that push because people are placing science in a position that science is ill-equipped to fill. And so giving science that God kind of status is highly inappropriate and pathological. So anyway, you see up top that there's an indication that science isn't always perfect, but we should still trust it. And so there are questions about, can you trust the science? And an indication that trust, honesty, and the authority of science, those things need to be investigated. And so you also have trust in medical scientists. This has been growing in the United States, specifically related to those of a particular political party. And it's hard to understand currently without more research why that might be the case. However, what's most important here is to remember that science changes. Science is founded upon theories, and then you do research and you create paradigms, but then there are paradigm shifts as you get more information. This is why science is not necessarily truth. Science is related to fact in search of truth. And so you can accept science in the moment with a mind towards the fact that science changes. And so what's good science today may be bad science tomorrow. And so you may come up with some other science, or you may come up with something that contradicts science. And so it's very important that people stop this foolishness with putting science on par with creators and with God, giving it that God status that's completely ridiculous. And so as we are wrapping this up, we are going to wrap it up with addressing very directly this assertion that it is a fact that antibiotics cannot prevent or treat the current situation. And one thing you might note when you look at the test kit in that square, you might notice that this is the test kit for the current situation, but it is also the test kit for mycoplasma. As we wrap this up, it is important again to remember to do your own research and then question the answers that you do find, but also to keep an open mind and always be prepared to engage in a paradigm shift. And this is particularly important because we are talking about a situation right now where the entire world has been shut down on the altar of this current microbe situation. And so not only has science been deified, you also have this dynamic where this microbe has been given sort of a God status. Everything has stopped on the altar of this particular microbe. Everything has shut down because of this microbe, and you even have it surpassing religion in terms of significance, and education in terms of significance, the entire economy, family relationships, everything has been surpassed by this little thing that has pretty much been used to take over everything. And so remember, you need to do your own research. It's not enough to just simply take what is told to you. You need to think for yourself, and you need to explore for yourself, and you need to question for yourself. You need to come up with your own answers. We have many, many physicians across this globe, and it is unconscionable that they have not come up with treatment protocols, case studies, lots of them, coming out daily to address this particular situation. Instead, individuals who are clinicians who should be doing that are sitting on the sidelines while organizations are sort of taking over that patient care role. And organizations cannot be your physician. You need to have a personal relationship with an actual physician to diagnose you and to also come up with health strategies and alternatives and medication regimens for your particular situation. Remember, knowledge is power. Take care. See you soon.